kid.
Well, welcome back. After getting your tonsils out, Tiffany's feeling left out because she didn't.
And neither did Renee.
Yeah, I know, because we were talking, you get all that extra attention, lots of ice cream, but it can be overrated when you're in a lot of pain.
Absolutely. But there's a new remarkable procedure that in many ways improves the traditional surgery. So Dr. Madan Kandula from Advent is here again to give us more details. And you haven't had your tonsils out either.
Nope, I still got mine.
Yeah. So we were saying
the tonsil club.
We were talking about the fact that we all three have it, and you said that's not that unusual.
Right.
But what is the purpose of the tonsils, and why do you think we still have ours?
Nobody really knows, to be honest, but the tonsils are made out of the same tissue as lymph nodes are. So there's a ring of tissue in the back of the throat where the tonsils are at the side of them, and then in the back is the adenoids. And that tissue, we think, is supposed to sample things as we bring them in. So as we swallow it,
there's
this
a
is
good
a picture.
Are those swollen?
Those are normal tonsils with deep pockets. So they're of pretty decent size. Those pockets can create issues. We'll talk about that in a second. But that's sort of a reasonable look back there as far as the tonsils go. So they're there. If they're not causing trouble, there's no reason to take them out. But for a lot of folks that cause trouble, and by all means, it's a good thing when we see them gone in those folks.
So why don't you give us a quick review? What was the old procedure, the kind of the tonsillectomy that we all heard about as kids, and that so many of our friends may have had?
Instead of the old, I'd call it more standard. So standard is removing the entire tonsil. So when we do that, and this shows a picture of this, we remove the tonsil and we go down to where the muscle is. And the muscle, when we unroof that can be really sore as the recovery process goes through. So that's still the standard. Most folks who get their tonsils out, that's how we do it, and it works really well. The problem is because we've got that bare muscle, it's uncomfortable, and it tends to be not a fun process for about a week going through that.
A week.
So it's about a week of kind of the bad stuff.
Yeah, and all the ice cream, which is the good part of the bad stuff.
Yeah, exactly.
So there's a new procedure that's coming out that's less painful. Is that correct?
Exactly.
How does that work?
So what that is, the difference is instead of removing the entire tonsil, what we're doing is leaving about 1 or 2% of the tonsil there. So we're keeping the muscle covered. So underneath that tonsil, where the muscle is, instead of leaving that bare, we're leaving a small capsule of tissue over top of that. What that means is instead of that raw surface there, we've got a surface that is not so raw, and it's a lot easier to heal up, which is the upside to that.
So would anyone be a candidate for this new type of procedure?
There are a couple types of folks that are really good candidates. So this little nasty thing up above the ruler
what is that?
It's called a tonsilleth, or a little particle that forms in the tonsils. So when we're looking at that first picture with those deep pockets, folks who have deep pockets in their tonsils can get tonsillets, little gross things like this. It's basically like plaque that forms in the back of your throat. It can be, they're stinky, they're nasty, they can give you a sore throat. Lots of folks have them, have no idea where they're coming from or what's going on, and I've had folks think they're kind of crazy coming in, and they'll say, well, yeah, sometimes I get these things in there. For folks who've got the deep pockets in them, those tend to be adults for the most part. This procedure works great because what we end up doing is recontouring the surface. So instead of those deep pockets, we've got a nice smooth surface there. Instead of the bare muscle, we've got the tonsillar tissue that's still there, maintaining that. So it's not a horrible recovery like a traditional tonsillectomy can be, and especially in an adult. But we are making a big difference. So if somebody's got deep pockets, somebody's got big tonsils, those folks tend to do really nicely with this. For folks who get repetitive infections, this can be an option. So it's sort of based on the problems that somebody's having, and then based on their anatomy as far as figuring out if somebody's going to be a good candidate for this or not. So
you said that this is good for adults who have those deep pockets. Is it also good for kids, and are they under anesthesia when they do it?
It's under anesthesia because it's hard to work. It's an area that's hard to work on with somebody who's awake because you got the gag reflex, so it's hard to do that. But the actual procedure usually doesn't take very long, about 15 minutes or so to actually get them out of there. So it can be good for kids. It can be good for adults. It tends to be a little bit more beneficial for an adult because of that reason. That adults, there's sort of this question mark as far as whether adults really have a harder time going through tonsillectomy. Absolutely they do. And this definitely, if somebody's really kind of hemming and hawing about doing something or not, this tends to be sort of an in-between option where it's, again, saving the recovery, getting, to the end of the problem and moving on with things.
So it's less pain, but also shorter recovery. How much shorter?
It can be dramatic. I mean, it's always shorter. It's always going to be less pain, always going to be shorter recovery process. I've seen folks where we do this on and they're back, you know, the next day they're out doing their normal.
The next day?
Yeah, exactly.
Wow.
So that's not the norm. I'd say most folks are down for a couple days. You know, typically for tonsillectomy, it's about a week. With this, it's about half the length and about half the severity. So it's still a sore throat, but you know, again, I've seen folks, you know, bounce back remarkably quickly from this, and you know, that's obviously a good thing.
So before we go, just a few quick signs for someone to look for if they think that they may be having troubles back there. What types of things could signal the need for a tonsillectomy?
The trouble. You know, basically chronic sore throats, those little particles, so they're called tonsilets. So those things, if somebody's having them frequently and they can be really, really annoying. It's just this chronic sore throat irritation sort of an issue. So those tend to be good candidates for this. If somebody snores and they look in the back of the throat and they've got pretty good sized tonsils, those folks a lot of times can benefit from seeing them gone. All the same things hold true for kids, although it can be a little bit harder to know, you know, because sometimes it's harder for them to relate to us exactly what's going on. But again, this is a procedure that is good for anybody, potentially for anybody who's got issues in the back of the throat.
That's great.
Right.
So really good information. Thank you for being here. Here's the information for Advent. If you think you may have a sore throat or any of those symptoms that are chronic that you've heard about here, you can contact Dr. Madan at Advent on Mayfair Road. Phone number on your screen is 414-771-6780. You can also go to advent.md for more information as well, and all the procedures and information that they do there at Advent. Thanks for being here, Doctor.
Thank you. Thanks for having me.
Always a pleasure.
Thanks.
And still ahead, how a new